Coronary heart disease is one of the world's most pervasive and dangerous diseases. It is the #1 cause of death in the world. Coronary heart disease is the most common type of heart disease, killing nearly 380,000 people every year. This is more than all other cardiovascular diseases combined. It all starts in the heart. Coronary heart disease is a disease in which a substance called plaque builds up inside the coronary arteries. These arteries supply oxygen-rich blood to the heart. As plaque builds up in these arteries, it hardens and narrows these coronary arteries, reducing the flow of oxygen-rich blood to the heart. This buildup of plaque is called arteriosclerosis. A common symptom of coronary heart disease is shortness of breath. This occurs because coronary heart disease causes heart failure, where a patient's heart cannot pump sufficient amount of blood to meet the body's requirements. As an aftermath of this, fluid builds up in their lungs, making it much harder for them to breathe. Another common symptom of coronary heart disease is angina. Angina is a chest pain that occurs when the patient's heart muscle cannot get enough rich blood. In association with the previous symptom, shortness of breath, angina may feel like something is pressuring the patient's chest, and it may also occur in other body parts, such as shoulders, arms, neck, jaw, or back. This world is plagued by this disease, as coronary runs rampant throughout society. The main cause is a sedentary lifestyle. As new inventions and innovations in junk food develop, the heart disease is more likely to affect more people. Another factor that increases your likelihood of getting coronary cardiovascular disease is smoking. This is a fact that is often overlooked when diagnosing coronary heart disease. The nicotine in the cigarette causes the heart to receive less oxygen-rich blood, thus increasing the possibility of getting coronary heart disease. These factors aren't the only ones, though. Coronary heart disease is also a genetic disease, in that if your parents or your grandparents had it, you're more likely to be affected. Scientists have also recently found out that your diet can also impact your chances of survival when struck with this disease. Vegetarians, in fact, have a 24% higher chance of survival than others. But there are ways to prevent all these terrible outcomes. Changing your diet, quitting smoking, and exercising are all things you can do to prevent coronary heart disease. While there are many different ways to prevent coronary heart disease, there is no way to cure it. Treatment only helps to manage some of the blood clots, but cannot remove the disease as a whole. Only you have the power to prevent this deadly disease and stopping it from becoming a worldwide pandemic.